Well, good morning, everybody, and welcome to another video from Patient Safety Learning. Well, I'm Peter Duffy. I should introduce myself first. I'm an ex-consultant surgeon, whistleblower, and we've got Helen Hughes with us, as usual, Chief Executive of Patient Safety Learning. And today we're joined by Bethany Carter, who is, well, you've had quite an interesting career, haven't you, Bethany? So you started off, I think I'm right in saying, as a military nurse, then you become a freedom speaker, guardian, then you've worked in a senior position in the National Guardian's office. So I think maybe the place to start would be if you could just take us through, fairly briefly, through your career to today, please, and just a very warm welcome to you.
Thank you, Peter. No, thank you for the invitation to have this conversation today. So I actually trained to be a nurse in the Royal Navy. I did about 8 years in the Royal Navy, had some really good experiences, was a general nurse, was fortunate to go to the Bahamas and Florida on a ship. I had a great time, but it got to a point where I wanted a bit more, I wanted to do more, and unfortunately at that time the opportunities just weren't coming whilst I was in the Navy. So I trained alongside RAF and Army colleagues, had some really good friends in the Army who made the suggestion that I could look into commissioning into the Army and becoming a nursing officer in the Army. So I went through that process. I was successful, so I transferred and commissioned into the Army. So I went to Sandhurst to do my officer training. And I then spent another, I think 9 years in the Army. During that time, I decided to specialise in infection control nursing. So that became my clinical speciality. And also during my time, I did a 7-month deployment to Afghanistan. And I also deployed to Sierra Leone during the Ebola epidemic. In January 2016, after 17 years in the military, I chose to leave. My husband was and still is serving in the Royal Navy. And our first child was about to go to school, so we wanted a bit of stability. So I left and I joined the NHS. I joined a local community mental health NHS trust in Portsmouth, and I joined their infection control team. And throughout my time there, I kind of worked my way up, so to speak. So as vacancies became available for more senior positions, I applied, and I was appointed as head of infection control at the start of the COVID-19 pandemic. So another challenging period in my career. And then from there, and what I saw during the COVID pandemic was actually what led me to become a Freedom to Speak Up Guardian when a post became available, again in the same organisation. And then my next move was to the National Guardian's office to work in the national arena regarding freedom to speak up. So that's kind of a whistle-stop tour of my career.
Yes. And obviously you've had quite an involvement with whistleblowing, both as a guardian and in the Guardian's office. Have you actually yourself blown the whistle on anything during your career?
Yes, I've had a few experiences where I've had to raise concerns. It was mainly around behaviours towards myself and some bullying. And I've had a good and bad experience. So one experience was very early on in my career, and it was about behaviours from a more senior nurse and some bullying that was going on. And it was starting to impact my, wanting to go to work, the way I performed when I was at work, because I didn't really want to be there because I was nervous and worried all the time. So I did raise those concerns at the time with another senior nurse. I was listened to, but I don't feel that anything changed. There was no actions from them, and it continued. And so didn't really feel heard, didn't really feel, listened to or valued at all. But, just kept on with it because I really wanted to be a nurse. I wanted to keep doing what I was doing and everything. But then another experience just a few years ago, again, it was to do with some unprofessional behaviours towards myself and my team at that time. I knew that couldn't go on and couldn't continue. It wasn't, again, productive to us working effectively and safely to deliver the care that we needed to. So I did raise those concerns. It did have to go down a formal grievance route, but actually the process was all very smooth. I was supported throughout the whole thing, and it did result in some actions and the situation being resolved. So that was a really good experience of a process working. But it was in an organisation where they really valued, listening to worker voice and trying to come to those resolutions at an early opportunity. So I do have those experiences. And what I would say as well, my time in infection control, as an infection control specialist, your role is to challenge practice, poor practice, challenge behaviours. So actually, I say to people, when they're saying how can we challenge practice, I say actually draw on the experience from infection control specialists, because they're doing it every day. They have to be able to do it to senior colleagues, across the board, whoever that is. They have to be able to have that confidence and feel safe to be able to do that. So I think from going into infection control, that really gave me some really valuable tools to be able to, face that next time I did have to raise concerns about something else. And I felt a lot more confident to do it. But, it's still a scary thing to have to do at any point.
And those two contrasting experiences, was there any one factor you think that made the difference there? Was it personalities, or was it that the general ethos had changed?
I think it was the leadership. So it was in two different organisations. In the one where I had the good experience, the leadership absolutely valued, they wanted to hear people. They welcomed people raising concerns, whatever that might be. They listened without becoming defensive. They gave you the opportunity to share what you were feeling, what you were experiencing. I think the previous one, it was kind of before Freedom to Speak Up came around. I mean, I didn't do it through a Guardian, but it was before there was that real emphasis on the need to listen. There was other priorities that were more important. So I think there was definitely the leadership difference was what made a difference to me. One, feeling that I could speak up that second time around again, especially after having a not good experience. And two, the actions that followed. So, we talk about in Freedom to Speak Up, don't we? Speak up, listen up, follow up. And that second experience, I saw all of those. And before I spoke up, from what I'd seen throughout the organisation, I felt confident that I would be supported throughout the process.
Okay.
So I just going to say, was that part of the motive then of moving into being a guardian?
Well, so I was actually a guardian at that time that I spoke up,
right,
but I was kind of, it was when it was an add-on role to my role as head of infection control. So what actually led me becoming a Freedom to Speak Up guardian was what I saw in my role as head of infection control during the COVID pandemic. So there was a few different instances, where we saw staff becoming positive with COVID, and then we had to isolate a number of other staff because they'd had contact with that person when they didn't have a mask on, which also led to us having to close for admissions for a short period of time. Because when we spoke to staff, they hadn't felt able to challenge their own peer, their own staff member, about the safe wearing of PPE. And obviously there was a lot going on in the COVID pandemic, especially in the early days. But throughout, we saw behaviours that were similar at different times due to lots of different reasons. And so I started to think, if we can't remind each other of safe practice on a peer-to-peer level, on a day-to-day basis, is there other things that staff aren't raising concerns about? What are those barriers that are stopping them? So I just started getting really interested. So I linked in with the lead guardian. They were sort of like looking for other guardians to support them to do the training. But like I said, at that point, it was an add-on role for my position. But when that lead guardian was leaving to move to another trust, I saw it as it was a real natural sidestep to apply for that role and take all those skills and experience I had with me to try and support, staff in the role of Freedom to Speak Up guardian. So that's what led me into that role.
Right. So this came during the COVID pandemic?
Yeah, so I became a guardian in early 2021. So it was still, the height of the pandemic. So I was head of infection control. I became a Freedom to Speak Up guardian. So I had so many hours a month that I could dedicate to that role to start supporting staff to raise any concerns. And then it was 2022 when I became the lead guardian. So that became my substantive role. Then I stepped away from infection control. And I think something that worked really well for me going into that Freedom to Speak Up guardian role was actually staff had seen me throughout the pandemic in my head of infection control. They'd built up a lot of trust in me, I believe, because I had to make sure we had the right equipment, the right knowledge, the right information, analyse the guidance, keeping everybody safe. I would speak to people during the pandemic, especially the early days. There was a lot of fear when we didn't know what it was going to be like, how bad it was going to become and everything. And, staff were really fearful. And I was there for them to be able to speak to me about their fears of IPC. So when I became the lead guardian, I think there was already an element of trust because I'd had that exposure during the pandemic. So I think that really helped me embed into that freedom to speak up guardian role.
That leads us sort of neatly into you becoming the sort of lead guardian. So what were your experiences in that position, just in terms of the general culture of the organisation and whistleblowing within the NHS?
So I was really fortunate that the organisation had a really good culture. Obviously, there was pockets where you've got microcultures that aren't so good. I think every organisation is going to have that. But the leadership really valued speaking up and were very supportive of myself in the lead guardian role. I would have great open conversations with the CEO, who really encouraged staff to speak up. So it started through the pandemic and it continued, like weekly CEO calls where people could join that call and raise anything they wanted to. And then he would make sure that there could be a resolution, things could get sorted out, or if not, he would make sure, that person was communicated with. And I would join those calls with him so they could see that it was, a joint way of working, but also I could pick up on themes of where things maybe weren't working quite as well, and sort of like try and do some proactive work before things became an issue. With regards to whistleblowing in the NHS, we see the negative stories, don't we? We see the big stories, don't have good outcomes for the people that are blowing the whistle. So I think for me at a local level as Freedom to Speak Up Guardian, it was really important to work across the organisation, with the EDI team, within the staff networks, learning and development, the leadership teams, to make sure we had a culture as much as we could where all staff felt that they could speak up and raise any concerns at a very early stage, whether it was about behaviours or patient safety, whether it was somebody that wanted to raise something under the, PEDA. I would treat everybody the same, make sure they got the right support as early as possible to try and make sure that resolution was sought, to make sure that there wasn't detriment faced. And one thing I was really keen on making sure the leadership had sight of was, if we're talking about people can't face detriment, what does that actually mean? What does that look like? Because it's easy to say the words, we won't tolerate detriment, but actually, what does that look like in practice? If we're not seeing detriment, that's great. But if we did, what are the actions that you would actually take? How can we, tangibly demonstrate how we aren't going to tolerate detriment?
Could I follow up with that? I'm fascinated by that open discussion with the chief exec. What were the nature of the issues raised? Were they predominantly safety issues, patient safety or staff safety issues, or were they everything and anything?
Yeah, no, absolutely. So when we did the joint calls, it would tend to be maybe systems and processes and things like that. The themes that I saw coming to me, there were patient safety issues, but that was in terms of, again, it could be systems and processes. People maybe were saying that they didn't feel that things were working, but they didn't feel listened to. They needed a bit of support to make sure their local leaders were listening to them. But it could have also been related to staffing levels. So it consistently short staffing levels, didn't feel like anybody was listening to them, or wrong skill mix. What I found was the very acute patient safety issues tended to be raised through the Ulysses, so through the incident reporting system at the time that way. Other things, so always inappropriate behaviours and attitude was always the highest themes that we had. And people would often challenge about, why does that matter? How does that impact on patient safety? And those kind of questions. But what I used to do, and what was really important for guardians to do, is to triangulate that information. So don't just, present the information of the guardian theme. So I would often link in with obviously the quality and safety team, but also the patient experience team. And sometimes we could see links. So, for example, it might have been that there was an area or a ward or a department that were reporting inappropriate behaviours and attitudes between staff, towards each other, etc. And then when we linked in with the patient experience team, actually what we were seeing is patients were reporting poor experience of care delivery, microaggressions when they're ringing their bells. And actually you get this picture that the culture within that department, for whatever reason, was causing an impact to staff and patients. So then you could work together to break down, okay, why is this happening? What are the causes of this? To try and then make it better for everybody involved. So there is that direct link between what the patient experiences if there's poor behaviours within teams and departments.
That's really quite positive and encouraging, I think. Obviously, we've heard quite a lot of negative stories in the course of these interviews, so that really does sound like a system that was working well. And presumably that provided you with a sort of launch pad then to go on to the National Guardian's office, did it?
Yeah, absolutely. So a secondment opportunity was advertised at the National Guardian's office. As soon as I saw it, I was really keen to be able to work at that national level. And I think it was because I'd had such good experience of being in an organisation where, speaking up really was valued. My organisation were, very supportive of me going for the secondment opportunity, wanting to sort of like elevate me and see me take my work into that national arena. So I was really fortunate that I was successful, and I went over to the National Guardian's office as the National Lead for Guardian Support and Policy. So working in the National Guardian's office, very closely, I had a team of 3, and our role was very much to make sure that the network of guardians across the NHS and beyond, so obviously there's guardians in hospices and other areas now, but making sure they had the relevant guidance, knowledge, training, support for them in their role, going out doing board development sessions, lots of different things to really help them in their role, but also help the organisations looking at their culture and how they could improve things with regards to speaking up. So I was really fortunate to be able to get that opportunity.
And how did you find it in general terms?
It was a bit of a roller coaster. So I loved my time at the National Guardian's office. I was so passionate about the work we did as an organisation, about the potential of the impact that we could make. But there are still areas across the NHS, and there are still organisations that still don't really understand the importance of speaking up. Still a bit of a tick box exercise. So it could be frustrating as well. But we would generally support those organisations as much as we could, as much as they'd let us, and help them, see the bigger picture. Guardians would contact us for one-to-one support calls, which could be anything from, I'm supporting this staff member with his case, actually, I don't know where to signpost them, so we'd talk it through, that kind of thing. Or we would get guardians contacting us because they didn't feel supported by their leadership in their organisation. So they maybe weren't getting the opportunity to present their reports at board level, which is what's expected of them. They weren't being given time to do more training or be developed in different things. So it could really vary. So yes, it was a mix of frustration, but also realising the impact that we could make to support the wider NHS and healthcare.
If I can pick up that, and we'll draw on, the changes as a consequence of the DASH review a little bit later, but it just reinforces, my perception that it can be quite an isolated role within organisations, and so you weren't just seeing that a few times. That was a bit of a theme.
Yeah, absolutely. And you're absolutely right. The guardian role can be really isolating. A lot of guardians are in an organisation on their own. They are one person. Some organisations have more than one, but it can be very isolating, which is why, being able to offer support calls was a really valuable resource that we could, provide guardians with. And we did see that quite a lot. The other thing that we provided guardians with was there was regional networks that had been established over the years. So they would meet, so North East region, all the guardians would meet quarterly to support each other and have that peer-to-peer support as well. And we would go and give an update from the National Guardian's office and take any questions. But one of the biggest things from guardians was, that was really important to them to have that ability to network with other guardians, albeit virtual. Sometimes it was in person because of the isolation in the role. And especially if they didn't have the leadership support to go to, or they didn't feel they could go to, that was really challenging for them. So well-being of guardians is vital, to look after their well-being as well, because they're listening to a lot of different things. It's very easy. And certainly when I first became a guardian, you take all this information and you're sort of like carrying it so to speak, at first. And it was a real shift to be able to actually get to that point at the end of the day where you could actually know, okay, I've heard all these concerns. Some of it, not great stuff. Some people were really distressed when they came to you, but you had to be able to balance that with actually, I need to step away now. The workday's finished. I can't carry this on me all the time, because you just won't be able to continue in that role for any period of time.
So moving on from that, you described this as being a bit of a roller coaster ride, so a bit of a patchwork of experiences. Were there any sort of common themes that you could draw out from that, Bethany? Things like particular types of trusts or particular specialties that you felt were really struggling?
Yeah, so certainly we saw throughout ambulance trusts that they were struggling with regards to culture. I think the thing with ambulance trusts and what we pulled out in this speaker review is often there's lots of close relationships within the ambulance trust. There's a level of hierarchy, for all the right reasons, of course, but that sometimes led to barriers to speaking up, sort of like, closed conversations, shall we say. But a lot of improvement has been seen in those ambulance trusts, and we have been able to support ambulance trusts with board development sessions to really make sure that the senior leaders understand their responsibility in creating that culture to let everybody, have a voice, feel valued and speak. Other areas, so if we think about acute trusts, any acute trust that is maybe struggling, having other issues, ongoing investigations, etc., I think sometimes there's that worry that if they keep encouraging people to speak up, there might be more bad stories come to light, more negative press. So they become less curious, they start asking less questions, so the voice starts to be diminished and starts to be silent. So then there's that false sense of security. Oh, nobody's raising concerns now, everything's okay. But actually, is it because nobody feels safe to speak up? I would say, thinking about mental health, I came from a mental health trust where we had a great culture. So, but I know there's mental health trusts where it's not so good. And again, I think throughout all of this, the actual theme is, it all is back to the leadership of the organisation and what their priorities are. And I think it's safe to say, and unfortunately, I think we see it in nearly every investigation, that's been into any healthcare failings, is that organisational reputation gets in the way far too easily. So when there's other things going on, when there's other things going wrong, and organisations don't want to draw any more attention to themselves, I think that speaking up culture is the first thing to go, because they're trying to protect themselves, possibly not in the right way. Yes. So it could be any organisation. So I think for me, rather than focusing on, what are the types of organisation, it's actually looking at the organisation and as a whole, but also in silo, and actually looking at the leadership and what is the leadership telling us about that organisation. And I think sometimes we like to draw comparisons. So we always used to get, if we went to an organisation, an acute trust, to do a board development session, it's like, oh, but what are we like against another acute trust? And you can't always draw those comparisons again, because there's so many different nuances, leadership styles and everything. So I always just say, don't worry about anybody else. Let's think about what you're doing. What are you doing well that you can continue to do well? What's not going well that we can maybe focus on? And actually, how do you bring culture into every conversation? How do you bring culture into your governance processes? How do you make sure culture is at the top of all the agendas rather than an add-on at the end? So I think for me, it's about organisations really need to look at themselves and take accountability for their selves and their culture.
Yeah. And how long were you with the National Guardian's Office for, Bethany? I'm sorry.
So I joined the National Guardian's Office in November 23, and I left the National Guardian's Office in March this year.
Okay.
Penny Dash Review into Patient Safety last year announced the closure of the National Guardian's Office, so it's going to close at the end of June. So that's why I looked elsewhere.
Yes. I think Helen mentioned that earlier on, so we were going to come on to that. But during that period of time, so you were there for well over a year, weren't you? Well over a year.
Over 23, 24, over 2 years, 2.5 years.
Did you, I mean, you mentioned this sort of patchwork, or perhaps I said that, but that was what you could imply. Do you think that there was an overall improvement in speaking up and in people's ability to speak up during that period that you were there?
Yes, absolutely. I really do.
Okay, good.
It's sometimes hard to measure that. It's sometimes hard to demonstrate that. But absolutely, I mean, what we saw from the figures that we produce in our annual reports is that more and more people were speaking up. So I think that's, for a number of reasons, increased awareness of freedom to speak up guardians, increased confidence that people will be supported to speak up and listen. But certainly we saw a year-on-year increase in staff raising concerns to guardians. Some people might argue, well, actually, the guardian's there as an additional route. They should be going through their line managers and all that. And yes, absolutely. But actually, I would rather somebody speak up to a freedom to speak up guardian than not speak up at all. So I think there has been an improvement. And I think we are slowly starting to see an improvement with speaking up at the more kind of like local level, team level, department level, that kind of thing. I think one of the issues that I certainly saw when I was a guardian and at the National Guardian's Office was the role of managers in supporting staff to speak up. So when I first became a guardian, when staff came to me, well, I would always say, have you tried speaking up elsewhere? There was two common answers. One was like, I spoke up to my line manager, but I don't feel like I've been listened to. And the other one was, I told my line manager I got a concern and they told me to speak to the guardian. So I think there's, two things there. Managers get to their position, especially clinical managers, get to their positions of managers because, they're really good, they've worked hard, they've developed, they've got to that role, they get to the manager level, but we don't actually give them any skills to be able to manage people. People are the most complex part of any healthcare system. So they don't know how to support people. They don't know who to go to. But also there was still that misunderstanding that actually the guardian is the person to report concerns to. No, the guardian is an additional safe route if that person doesn't feel safe to go anywhere else or feels that they have tried other routes and haven't been listened to. So they need that additional support from the guardian.
And that leads on to another thought. We just talked about NHS managers here. What's your opinion of the proposed sort of licensing or formal regulation of NHS managers? I mean, we know that I think the point has been broadly accepted, but it's all gone a bit quiet, hasn't it? I think there is potentially planned legislation, but what is your opinion of that?
So I think any licensing or registration, if it's done properly, if it's done with accountability, with the right processes in place, and it leads to improvements throughout the organisation culture, improvements in managers' performance, and then it could be a good thing. But is it just a
tick box exercise?
Yeah, is it just a tick box exercise? We've got this issue, let's throw something else at it to try and solve the issue.
Yes.
Is it really going to solve the issue? I think sometimes we need to step back and go back to basics and see, what is the problem? Why have we had this issue with managers, etc.? Do we need to throw another registration or licensing at them, or actually do we need to provide them with more support, the relevant training, the relevant knowledge within their organisations to do their job properly? So I'm a bit...
Well, maybe all of that.
Yeah.
As you say, it's not a substitute for that. And what made me think, it's not something that I'd anticipated asking, but it's triggered in my mind, your reflection about people speaking to you as a freedom to speak up guardian or being directed to you from your managers. Where does the HR team sit within that? What the relationship between guardians and HR, particularly where many of the issues being raised are about behaviours and disrespectful or discriminatory behaviours?
Yeah, that's a really good question. So HR is obviously a separate route. And I would always work closely with the HR team in terms of, again, the triangulation of data, what the information we're seeing, the patterns of behaviours, etc. If somebody was to come to myself as the guardian and raise issues around behaviours, I would always have the very open conversation with that person. what were their sort of like expectations of what they wanted to happen. I would remind them, that obviously there are processes such as formal grievance and everything. And if they wanted to go down that route, then I could link them in with the HR team if they wanted to. Sometimes they didn't want that. They maybe just wanted me to support with them speaking to their manager, so their manager could try and address it at a local level. But if it did need to go into a HR process, I would support that person, link them in with the relevant people. I would then step back because they were going into a process with HR, but I would just occasionally sort of like reach out to the person that's spoken up to me, just checking everything's going okay. Do you need anything? If they come back to me and said, HR contacted me 2 weeks ago and I've not heard from them since, I could then get in touch with HR and just say, they've come back to me and said this. So for me, it was very clear that there were separate processes for the Guardian and the HR. But if I needed to support that person to link in with HR, then absolutely, that's what I could do.
And it demonstrates how important but how complicated the role of the Guardian is. And so, again, not something I planned on asking, but when Guardians are appointed, what's your sense of the training and support they get to be able to optimize the opportunity of doing that role well? Because if you've made the transition from a clinical role or a managerial role, as you say, it's quite a different skill set. So what support do Guardians get on appointment? Is it very much down to a local organisation? What was the National Guardians Office doing around that? Be worth getting a little bit of an insight from you on that.
Yeah, so the process is going to be changing with the closure of the National Guardians Office. And obviously having left, I don't know exactly how that's ironing out at the moment. But certainly when I became a Guardian, and up until very recently, when somebody is appointed a Guardian in their organisation, they would then contact the National Guardians Office. So I've been appointed as a Guardian. Can I please have access to the training? And the National Guardians Office would provide their foundation training. It was in two parts. It was e-learning, so it covered all the things to expect as a Guardian, how to deal with different things, etc. There was like a workbook for them to complete as well. They would do that, and then we would register them as a trained Guardian, and then within, I think it was 3 months, I can't remember off the top of my head now, but within so many months, they then had to link in with a Guardian mentor. So they were experienced Freedom to Speak Up Guardians who had done specific mentorship training. And at that point, the new Guardian would have a reflective conversation with that experienced Guardian about their first few months, reflect on any issues they'd had, really supportive conversation. And at that point, when they'd done that second part of Foundation 2, that reflective conversation, they'd done all their initial training. They were there to take on cases and get involved and everything. We always got very good feedback from that training. Obviously, I did that training myself. And that's supported with lots of useful resources. So like starting out, stepping down guidance, which, if somebody's coming into post, gives you what you need to do. But also if you're stepping down from a post, the things you need to do, thinking about open cases, all those kind of things. So lots and lots of great resources for Guardians to support them in their job, on top of the fact that we could also offer support calls and different things. And then we also used to look at the themes that we were getting from Guardians in terms of what were they contacting us for regarding support calls. And then we would tailor annual training for them. So, for example, we did a training package about neurodivergence because they were struggling to have those conversations with neurodivergent staff members. We also tailored some of the guidance we gave. So we were getting an increase in Guardians contacting us because they were being asked to either provide evidence or actually attend employment tribunals. And this was becoming more frequently, so we did an employment tribunal fact sheet. So we would always be thinking about actually what is it we're hearing from our Guardians, what more support do they need in their roles, and really tailoring that and providing that guidance and training for them. So I think, and I know when I became a Guardian, the training was very good and the support was very good. But I do believe it is changing with the change and the closure of the office.
I know you've left now quite recently, but what's the expectation of that very rich resource and support for Guardians? Is that going to go anywhere else, or is that just going to dissipate? Or do you know if there are any plans, what they are?
Yes, I believe NHS England have published their proposals now for what it's going to look like moving forward. Obviously, still working out finer details, etc. I believe there will be still some one-to-one support for guardians moving forward, and there will be training, but I think it will be accessed differently than it is now.
And from NHS England directly?
Yeah, from the NHS England Freedom to Speak Up team. Yes, I believe. Yeah. But I think my worry is, obviously, when we had the National Guardian's Office and we had a National Guardian, for the NHS, you kind of had that oversight. And when guardians did come to us and weren't getting leadership support, they'd come to us for guidance. They'd go back to their organisation and they could say, I've spoken to the National Guardian's Office, this is what they're suggesting, advising. And sometimes they had to use it as kind of like a lever, which they maybe shouldn't have to do, but fortunately they did. I don't know if that same oversight and leverage is going to be there when it's embedded within NHS England as opposed to a separate organisation, if that makes sense.
They may be interpreting it as a different role.
Yeah.
And I suppose maybe guardians wouldn't see that as such an independent support framework as the National Guardian.
Absolutely. I think some guardians, what I was hearing, the worry is, the National Guardian's Office, although we didn't necessarily have some of the powers that they maybe wanted us to have in terms of that, the national support now is sitting within the regulator, and I think that feels uneasy for some guardians.
Mm-hmm. Okay, I've got a couple more questions just before we start potentially wrapping things up. So I think part of your role when you were in the National Guardian's Office was strategy. Did I get that right?
Yes. So my last 9 months, I was the interim director of operations and strategy.
So where would you have liked to take the National Guardian's Office and the sort of national strategy had you been able to keep going with that post?
The strategy was looking at, we wanted to be kind of like the centre of excellence for speaking up. I think change was needed. We were seeing things like guardians starting to face detriment because they were raising things in their leadership. Leadership weren't happy with it. Actually, there was no real protection for the guardians. So they would come to us for support. We had to stay impartial. Of course, we could, offer them support calls and things, but actually all we could do was escalate it to the regulators as well. So I think there was some change needed in terms of how we could better support and protect guardians. But certainly it was looking towards being, like I say, the centre of excellence for speaking up, being there to be able to have that voice, to be able to continue to challenge healthcare, leadership, etc. But when I got into that role, the closure had already been announced. So my 9 months was taken up working closely with the Department of Health and NHS England towards the transition of some functions and then the closure, unfortunately.
And did you get a lot of support? Sorry, this is another question now. Sorry. Did you find when you were working for the National Guardian's Office that the sort of oversight and the support from NHS England, from the Department of Health and Social Care, and I suppose from the Office of the Secretary of State for Health and Social Care, that sort of very senior authoritative backup, did you feel you got the support you needed?
Yeah, I think so. When I was in the national lead role, obviously I was maybe a step back from that, but certainly the impression I got from the leadership within the office is that the support was there. We always worked very closely with NHS England and CQC, for example. So sometimes we'd have to discuss certain cases. So we were always there. There was always that support at that kind of operational level as well.
Okay, I mean, what I was going to start wrapping things up with is a question I'm often asked, and I'm sure Helen is as well. There will be people who will watch this who will be in the process of some sort of speaking up or whistleblowing issue. What sort of advice would you give those people as to how to set about it whilst sort of maximising the benefits for the patients and minimising the risks to themselves?
Yeah, so I think what I'd say to anybody that is wanting to speak up, whatever it's about, is firstly, it will be difficult. It will feel difficult, and that's okay. That's just a natural feeling. So don't let that put you off. If there's anything that's bothering somebody, no matter how big or small they think it is, first steps, I would say find somebody you can trust, whether it is your line manager, it could be a colleague in another department, it could be the Freedom to Speak Up guy, whoever it is, find somebody that you feel you can trust and go and speak to them. I would also say sort of forget about terminology and process. So one thing I found was people would often be put off speaking up because they didn't know if it was a complaint or a concern or a grievance. Doesn't matter. If something's bothering you, find somebody to speak to. If there's a process, that process will follow after you've got the right support. So take a deep breath, find somebody you trust, speak up, because we need to hear what staff say. If we don't speak up, if we keep going, think somebody else is going to speak up, we're missing so many opportunities to learn, to grow and to improve. It will feel hard, it will feel difficult, that's okay. Find somebody you can trust, speak to them, and the rest will follow. And just make sure you've got that support throughout.
Great, thank you very much, Bethany. Helen, was there anything else you wanted to ask?
I think that's a very powerful way of ending, Bethany. Thank you. And I mean, it reflects some of the people that Peter and I have interviewed in the past who, I think every single person that has been a whistleblower, when usually it's Peter asks them, would you do it again? Every single one has said yes, but I would do it differently. I'd be more careful. I'd make sure I had more support. I wasn't so isolated. And then, if you're working in an organisation that may be a bit toxic and is going to treat you poorly as a whistleblower, then you're not alone. So I think your advice is very, very well made, and it's a good and quite positive way to end the interview. So nothing else from me, Peter.
Yes. Yeah. Well, thank you very much, Bethany, and good luck as well with your new career. We chatted about it off air a little earlier, didn't we? It's sort of an army or a military post-traumatic stress charity, which all sounds very, very worthy work. So good luck with that. Thank you for everything you've done, and thank you very much for today's interview. It's been very illuminating.
Thank you. Thank you both.